I welcome all of you to IBM TV and to this show, which is Dr. Dhawan's live chat, and I'm your host, Dr. Sanjay Dhawan. I'm an eye surgeon practicing in New Delhi. The live chat is a show which talks about any and all aspects of life, any subject, anything that concerns the life or it improves its quality is what we will be talking about. How to plan for it, how to prepare for it. So we'll be talking about all of this. Looking forward to seeing all of you every Friday night, 9:30 p.m. to 10:30 p.m. Indian time. Thank you. Bye-bye. Namaste. Namaste. Good morning, good afternoon, good evening. Welcome to yet another session of Dr. Dhawan's live chat. Life. Yes, that is what is at stake these days. There's a danger lurking large over everyone's life. We're passing through some very, very sad and very tragic times, especially here in India, with the second strong wave of COVID creating a havoc all around us. So many people are suffering. So many people have died. There is almost a tsunami of patients everywhere. There are not many beds available in the hospital. There are hardly any ICU beds available. The drugs, oxygen, other supplies are running short. So we're actually facing some very, very difficult times here in India. And at this point of time, we thought that we should talk about the subject further in greater detail and also help empower our audience to be able to deal with the situation, to be able to deal with this disease, because many a times patients can be quite easily managed at home. At least all the mild forms of disease, even moderate form of disease also, can be quite easily managed at home itself with proper guidance, with proper knowledge and proper awareness. The times are so sad that one of our producers, Ankit Khandelwal, he himself and his family got COVID. He's recovering from it, but unfortunately, he lost his father yesterday to the disease. So I take this time to offer my condolences and a humble prayer to the departed soul. I have with me two very special guests on the show today who will be talking to us about this subject, and let me call upon them. I first invite Dr. Meenakshi Ahuja. Dr. Meenakshi is a friend of mine, a gynecologist by profession, and my batchmate from college. Recently, she and her family also suffered from COVID, and right now she's in isolation and recovering from the same. So, Dr. Meenakshi, welcome to the show. I also invite Dr. Nidhi Dhawan, who is my wife, an ENT surgeon, and who's been treating a lot of COVID patients and guiding them and helping them over the past many months. Nidhi, welcome to the show. In fact, recently, my father-in-law also developed COVID after his second dose of vaccination. And we first thought that his illness is as an effect of vaccination itself. So we took it a little lightly. But as things became worse, we got him tested and found that he also has COVID. We have been able to, stabilize him at home itself. And fortunately, we ourselves have been safe. We have not been infected so far, despite having been exposed to him. So strangely, the disease, this virus behaves in a very, very strange way. We don't really know everything about this virus. And at best, right now, we are all in dark. So let me start with Nidhi. I think we all know about the basic precautions now, but let us go straight ahead to the disease. Nidhi, right now, with so many people getting affected with this disease, how can one pick up the disease at its early stage? What are the early symptoms and signs which should alert the person and the family towards the possibility of having contracted this infection?
So I would say that at present, anything which is unusual for you could be COVID. Whether it is a dry throat, or it is a headache, or it is a stomach ache, or it is body ache, anything which is unusual for you could be COVID, and you should be alert to it. If more than one member of the family are having similar symptoms, be doubly alert to it. Assume it is COVID, because the sooner you start treatment, the faster is the recovery and better are the outcomes.
So, but the typical symptoms, of course, are in the form of fever, which is usually low grade, does not go very, very high. And there is dry cough, there's body ache, there's lethargy, there may be headaches and weakness in the body in the early stages. But of course, there can be atypical symptoms presentation also, like you
I
said.
I would say that right now, don't go by just fever. I mean, don't be reassured that if you don't have fever, it's not COVID. And that's why I did not mention fever. Yes, typically, COVID would present with an upper respiratory kind of thing, that you're having a little cough, some cold, some sneezing, and you're having mild fever. But that's not to say that all cases are presenting like that. Some cases are presenting without fever, and so anything can be COVID. And if more than two people are having similar symptoms, please get yourself checked.
So I believe the idea here is to convey to the people that any symptom, any illness, any form of discomfort can be an early sign of COVID. So be alert to the possibility of it being COVID and do not ignore it. And anything that persists for longer than a few hours and affects more than one person in a family should be taken very, very seriously. If somebody experiences any of these symptoms, and how to go about it, how to get diagnosed, and or is it important to get diagnosed first, or should one start the treatment first?
So at present, we are seeing a lot of guidelines floating around in the WhatsApp university. And unfortunately, these guidelines are not making it easier. They're making it more difficult for a normal lay person to really decide what they should do. The standard of care demands that you isolate, that in the first 2 to 3 days, you take symptomatic treatment. The fever that comes on with COVID responds better to Meftal rather than to your usual fever medicines, the Combiflams and the paracetamols. So if you do suspect that you're not well, then mask even at home, start mefenamic acid preparations, and try to book yourself for a very basic blood test, the complete blood count. If you can add a CRP to it, it would be great, because this allows us to monitor the progress of the disease. But simply a complete blood count can throw up huge indicators to start treatment in the right time and at the right point of disease.
So do you mean to say that one need not necessarily wait for RT-PCR to be done, because
No.
the huge rush, RT-PCRs, there's a lot of waiting list for that, getting it booked. Even the reports are taking a lot of time. So simple tests like CRP and CBC can be an indicator to start the treatment.
Absolutely. And RT-PCR, people think that if they are RT-PCR negative, they are COVID negative, which may not be true. People think that they are RT-PCR positive, and so they have severe disease. That may not be true. So, and RT-PCR is simply checking for some viral fragments. It is not checking for replicating virus. So even if you had COVID 10, 15, 20 days earlier, and your body has not completely eliminated those viral fragments, you may still be RT-PCR positive, but not transmitting the disease.
And also the flip side, that in almost 30% of cases, it may miss the presence of virus also.
Yes.
It may be false and negative, and which may fool you to believing that you do not have the disease.
That you do not have the disease.
No. And so it's better to rely more on the clinical presentation and on other tests like CBC and CRP. I mean, Meenakshi, what were your first symptoms, in your family? How did you guys pick up? And I believe you've all been vaccinated also.
Yeah, so incidentally, all of us are doctors at home. My children are also both doctors. So my husband, my children, and we'd all been vaccinated. We'd received the second dose more than a month back. Our household full-timer had just received one dose of vaccination. And my mother-in-law had also by now received both the doses. So definitely we've been out in the field every single day, and I've been actually thinking of it like a paintball. You know that you are taking all your precautions, but it's just that 1 minute lapse and you can go. Surprisingly, my husband is little, I think, well enough. So just, my help was having a little sore throat, and he said, let's just get the test done. And she turned out positive, and then she was isolated immediately. She's a full timer, but apparently downstairs she must have met some other help or some driver or someone. So, and in the kitchen, unfortunately, when I'm working with her, I don't wear a mask. Sometimes she's wearing a mask, so I guess that's where the lapse happened. But what actually happened was that I went to work and I sat in the OPD and I had this excruciating backache. I thought maybe because the help is not there. For a moment, I thought that maybe I was working too hard, but then we are all used to working hard. I knew it wasn't that. I just got up from my chair, rang up my MS, went to the isolation room on the first floor and told her that please get my sample done immediately. Rang up home, told my husband I'm reaching home in 20 minutes, get out of my bedroom. And I am positive. I know it because this backache feels like nothing I felt before. By the time I took a dolo for the backache, and by the time I reached back home, despite the medication, my samples done it for 2 hours, I had a temperature of 101. So I completely isolated. I didn't wait for the report. I started my meds immediately. And the next day, the rest of the family tested. My son was completely asymptomatic, but he turned out to be positive. My mother-in-law was having a cold and little fever. She's turned out to be negative. We've repeated the test for everyone about again. And my daughter's having low-grade fever, but she's negative. My mother-in-law is still having symptoms. She's negative. My son is asymptomatic. He's positive. So
So
it
you're
is a
making
mix of
very important points. Very, very important points you're making in this. Two things that you have brought out in this, Meenakshi. One is that the pain was something you have never felt before. So if there
yes.
is anything unusual, be alert, it could be COVID. So that's the first thing that I was, what I was saying earlier. If
Yeah.
it is unusual, be alert. And
And
the
I
other
just
is
walked out of the
positivity,
OPD because
negativity
I
is
didn't
not
want to infect anyone else. Although I was wearing
absolutely.
an N95, I just walked out and I told everyone at home, just move away. So that was, I think, the most important and the first step that you can take.
Yes.
So
And positivity and
basically,
negativity is not the criteria to, determine whether you're sick or not. In this
Absolutely.
case, absolutely.
the symptoms, the test results, they need not match. No? They may not conform. This virus is not conforming to the usual normal trends of any disease. It is defying all the trends. And I've been saying that it's been defying science, it's been defying statistics, that all the trends it's defying. Right now, we practically know very little about this virus. The way it has evolved over the period of last 1 year, the way it's behaved across the world, it only tells us, one thing, that we know hardly nothing, almost nothing about this virus. Despite the vaccination, people are getting infected. So what could be worse than that? So coming back to the early disease, so Nidhi, if somebody has symptoms and the tests are still awaited, what can one do at home?
So I would say that firstly, as Meenakshi said, isolate. And be in a room which has an attached bath and you don't have to mingle with anybody, even in the corridors. Secondly, even for the mildest of symptoms, start taking anti-inflammatory drugs. Drugs which we know, like anti-allergics, plain cetirizine, drugs like mefenamic acid, Meftal, which we've been taking for period pains or for stomach ache. These are the ones which start early and act on the earlier stages of the chemical imbalance in the body. But also drink plenty of fluids, drink warm fluids, and focus on your immunity. Keep the air circulation in the room to the outside, not to the inside of the house.
Also, there's a talk about various other drugs which can be started early in the course of disease, things like ivermectin and all. No? And also, when we mention these drugs, it always gives rise to a lot of debate in, at least in our professional circles, amongst our professional colleagues. People say that there's no scientific evidence to support use of these drugs,
Oh,
and there's
no,
a lot
no,
of
no,
debate
no.
which goes on. No?
No,
So,
no.
tell me about those drugs, which one can start early,
So,
and what is the logic behind using those drugs?
so I would say that ivermectin is now a confirmed, scientifically proven drug which has anti-inflammatory activity, antiviral activity, virostatic activity, antibacterial activity, and anti-helminthic activity. It acts on all parts of the viral cycle. It prevents the attachment of the virus to a cell body. It once a virus escapes into a cell, it prevents the virus from inhibiting the first response, the INF alpha response, which causes other cells to be alerted to the presence of the virus. Once this has happened, the ivermectin also prevents the replication of virus by the RDRP pathway. Once the virus is eliminated and there is dead virus debris all around you, ivermectin also acts on the interleukin and the TNF alpha pathways to suppress inflammation. So ivermectin, a very simple, cheap, inexpensive, safe drug with a huge window of safety, actually acts on all parts of the pathway. And in very high therapeutic index, very high window.
Meenakshi, what is your opinion about this? When
So,
this scientific argument comes into play, you know.
so honestly, I've not been very scientific about all this, but yes,
Yeah.
I was taking prophylactic ivermectin anyway, being a healthcare worker.
Yeah.
And as soon as I mean, I knew it was COVID. There was no other, it was nothing else. I didn't wait for the report, frankly. And I don't know whether I was right or wrong, but day one itself, I started with crocin because I had high grade fever. I was taking zinc and vitamin C. I started azithromycin, and I don't do well with doxycycline, so I decided started that, and I started the therapeutic dose of ivermectin. I also started Fabiflu. So I'll be honest, but the next day, then I've been fine. So I don't know whether it was vaccine, whether it was the drugs I took, whether it was just everyone's prayers, whether it was good luck, whether I'm God's favorite child or whatever. But touch wood, knock on wood, things have been fine after that. And from day two, yes, it's not been bad at all.
Right.
But
So
I think,
let me.
Meenakshi, I think what you said that, azithromycin, doxycycline, these things, of course, people should take on prescription.
Exactly.
But ivermectin, I would say, is something that we've been giving to our kids. We have been giving to even patients who, when you're operating, you find head louse, you give a tablet of ivermectin. You've been giving it to your puppies. It is a perfectly safe drug.
I was
So,
taking prophylactic dose also, otherwise, the day 1 and day 7 dose anyway. So I think ivermectin really helps. And everyone in the house was on a prophylactic dose anyway.
yeah.
So to these scientific minds and skeptics, let me put it in perspective. Science says that after vaccination you should not get the disease, but the disease is happening. Science is always, any studies, any research is always based on some hypothesis, some hunch, some isolated observation, some anecdotal doubts or anecdotal feelings and guess. That is where things get first tried, and then to give them a proper scientific shape, studies are conducted. Right now, it's a very emergent situation, a very catastrophic situation. There is no time for us to wait and do the studies and wait for the results. People are dying. We have to save them. The situation is very, very desperate. And if in this desperate situations, if we find, okay, that somebody has had some success with some medicine, why not try it? We can always look back and analyze our results in future. So I would say that, okay, fine, science is perfectly fine, but let us not waste time in a scientific argument at the moment. Right now, the time is to save people with whatever means which are there at our disposal. We know nothing about this virus. We know nothing about the treatment. We don't really know whether what works now. And things are only evolving. The collective knowledge is evolving. We know for sure that it is not the virus which is killing people. It is the inflammatory effects which are killing people. Virus stops replicating soon enough, So all the antiviral drugs, they work early in the part of the disease, but it is the latter part of the disease which is actually more catastrophic, where all the anti-inflammatories, anticoagulants, and all those things are really working. So yes, Nidhi. Yeah.
There was a question from Pankaj
Yes.
as to how many days you should take it and how you can take it. So I would like to tell you that ivermectin has been proposed in 2 or 3 regimes. Any regime is fine. Right now, we are just figuring out which one will work for you. 12 mg for all adults, once a day for 3 days or 5 days. And then you can either take it weekly or you can take it fortnightly, depending on your level of exposure. 1 tablet weekly or 1 tablet fortnightly, depending on your level of exposure.
So the question is also coming about the oxygen dropping after 5 to 6 days. Now we'll be coming to that part of the disease now in our discussion, and also about it being airborne. Again, we'll be touching on that part also. So Ashwini and Ashwin, just you'll get the answer of your question too. So in the early stages, say if the test comes positive, and you start the treatment early, it's very, very important to start treatment early at home. So if the test comes positive, then what else one can add to the treatment?
Should I take that?
Yes, please.
Yeah.
So I think the first thing is that you keep your thermometer with you and keep your pulse oximeter with you, and if possible, keep a spirometer with you. So this is the 3 basic things, and definitely keep your sense with you. It's really important that you kind of just don't panic unnecessarily. 90%, it's a given, proven fact that more than 90% is going to be a mild disease, right? So with that confidence, go ahead. That most probably you're not going to be foolhardy, but you should fall in the 90% category. And you must take care of yourself so that you continue to follow in that category. And if you move this way or that, we'll take it from there. So yes, you keep on checking your oxygen with the pulse oximeter. I think 4 times a day, check your temperature, do your breathing exercises, eat your supplements like the vitamin C and zinc, and of course the other medications like ivermectin and all. And definitely have a routine on your days, how you're going to spend the whole day without any negativity. It's really, really important. I mean, I don't know, I can't overemphasize the effect of positivity, keeping yourself busy, I know, it seems very selfish that at this time when the whole of Delhi was burning, I actually have not been watching TV. I've not been seeing this, because at the end of the day, if I want to be helpful, I have to get okay first. So
Correct.
Keep your routine, and definitely, like, half of us are working from home anyway. People who are not doctors work from home. So continue doing your work. Maybe you can do half the work you do. I've been doing my video consults every single day, except the first day when I came back home and I was having high-grade fever. I've been doing video consults every day between 12 and 5. So you keep your routine. It makes you feel good also. You feel productive. You feel that you're doing something good to your day. Also gets you tired after that, so that you rest and don't have enough time to kind of just keep on reading WhatsApp forwards and news and, this medicine not being available and all. So, and honestly, we didn't hoard anything in the house at
Absolutely.
all. So I don't have
Absolutely.
remdesivir in my house. I don't have an oxygen concentrator. I don't have an oxygen cylinder. I know that people are hoarding it also, but it's unfair. Unless and until somewhere you feel that there is a problem. And see, at the end of the day, you required it, Nidhi. It was difficult to get it, but you managed at the end of the
Yes.
day. There
Yes.
are people who are going to help you out, but unnecessarily holding it and taking it away from people who actually need it would not be a great idea.
Yeah,
Yes.
that's what when we were really asking for it, and people said ek ki jagah do de dete hain. I told them no, I don't want to take it away from somebody who is who needs it more and who is in a more critical situation. I don't have remdesivir at home. I do have a box of Fabiflu, but we haven't opened it. because I don't put too much trust in antivirals anyways. However, yes, given the seriousness of the disease, if I find that somebody is clinically much worse off than I'm comfortable with, or I find that it is in this phase where the antivirals will work, I might add that.
Yeah.
Also, to whatever you said, Meenakshi, I think it's a good idea to whoever, in any case, whether you're sick or not, figure out what is your baseline activity tolerance. And you can do it with a simple 1 minute or a 5 minute or a 6 minute walk test. So you set about walking a room back and forth and see how many chakkars you can do in 1 minute, and do it every few hours. If you're walking less, or if you're getting breathless walking, same, or if your pulse is rising too much and you're feeling uncomfortable walking, same, they're good indicators to alert you that something is not right.
Yeah, but the point which Meenakshi made about your outlook, your approach, your positivity is very, very important. I even had my intensivist friends telling me that patients who reach the ICU stage, there are patients who remain positive in their outlook. They do much better than others who despair and who have a negative outlook. So it's very, very important to maintain a positive outlook and a positive frame of mind at all stages of disease and all severities of the disease. It really helps. And the reason is very, very simple. Every part of the body is connected with the mind. Body affects mind and mind affects the body. There's a two-way flow which happens now. If we are happy, if we are comfortable, our immunity works to the best of its ability. All our resources are directed towards dealing with the disease rather than dealing with the anxiety and other factors. So a positive state of mind really helps. Plus, when you're in a positive state, you do the right things at the right time. That itself helps in your proper recovery. Coming back to the disease part, what other tests should one get done, Nidhi?
So I would say that to initiate treatment and to escalate treatment, a complete blood count and a CBC are fine. They should be done on every alternate day. CRP, CBC and CRP. Yeah, these are fine and should be done on every alternate day to see the trends. If the trends are rising, then you have to take medical advice and ask for other tests, which could include, but are not limited to, a CT scan of the chest, D-dimer, IL-6, and all the other inflammatory markers that do happen. I personally feel that CBC and CRP, along with, if the chest symptoms are becoming prominent, a CT scan of the chest are adequate to monitor clinical course as well as escalate treatment. RT-PCR and CBNAT and rapid antigen test, these are only going to confirm your clinical suspicion, but they are not determinant of the course of the disease nor of the escalation of treatment.
So right now, because of an overload of patients, even the labs are overwhelmed and it's not easy to get the test done. So will it really help to keep the tests to minimum required?
Yes. Yes. And that's what I'm saying, that we go with the basic blood tests, and any neighborhood lab can do these 2 tests and give you the report in 2 hours to 2.5 hours. That too, nowadays, is becoming very delayed.
So what are the red flags or signs where one suspect that the disease is going into from mild to a moderate severity or stage?
So we've lived it in the last 10 days. If the cough is increasing, despite adequate treatment, if the fever is rising more than 101 and not coming down despite adequate treatment, if the pulse is rising more than 100, if the respiratory rate is rising, if the blood pressure begins to fall, if your exercise tolerance or effort tolerance is falling, if somebody is feeling uneasy, if they're looking confused, and if they're not able to do the usual tasks that they were doing, all these are red flags. All these are red flags.
So what to do in that situation?
In that situation, reach for emergency help. That is the time that you should not be staying at home. And even though, our overseas friends will be appalled at what I'm saying, at this time, giving a tablet of a reasonable steroid can be life-saving. It can be life-saving to have given that tablet of steroid, because it's the inflammation which is kicking in and which is preventing the lungs to aerate.
When does it happen? After how many days of the disease starts?
So the first 5 days of the disease are the replicative phase, which is what, your usual cough and cold. Even our cough and cold are really coronavirus diseases. But those are human coronavirus diseases, which we have become immune to and which we know how to deal with. So it's a mild illness which you just get rid of. And the viral loads are so heavy in COVID-19 that the lungs are overwhelmed by the debris of the dead virus. And the inflammatory response, because the body doesn't recognize this, the body mounts an immune response to fight it. And it's this immune response which is really causing the consolidation of the lungs and which is preventing oxygenation. It's the inflammation which really begins to take you downhill. It's not the virus.
So, but if the moderate disease comes up a few days down the line, and already the replication of virus has stopped or is declining,
So
is it not very safe to give steroids then?
That's what I'm saying. That start the steroid. That's exactly what I'm saying. So if you're already on day 4 or 5 of your symptoms and you find that you're suddenly going downhill or you're not getting better and you're seeking help, there are a lot of initiatives that our doctor friends have started. There are online clinics. There are volunteer 24/7 services. Meenakshi is talking about a video consult. I'm consulting with people 24/7 practically. So sometimes you want to cry because it's like a fire outside. And I don't think that, blaming somebody is easy, but it's not the right thing to do right now. Right now, please stay indoors. Please look after yourselves. At the first symptom, isolate, mask at home, don't eat at the same table, take care of your hygiene, take care of your mind, be positive, set in a routine of some little exercise, take your vitamins. At the first sign that it is going bad, reach out for help. It's available. If you can't get help, take a tablet of ivermectin and one of any steroid you have, reach out for help.
And if I may add with Nidhi that get your vaccination done.
Of course, we will be coming to that in any case. No, but Meenakshi, you mentioned about Spirometer. Can you just elaborate on that part, please?
So Spirometer is basically something which is a device which helps you in oxygenating. In fact, I think I have it right here because it's in my room. So this is exactly what it looks like. It has a mouthpiece and it's a device which has 3 balls. So basically it's going to improve your lung capacity because you work on checking your lung capacity and doing the exercises to open up all the alveoli in your lungs. That means all the small parts of the lungs which may not otherwise open up. So the aim is that you just take a deep breath. You push out your breath and then you take the mouthpiece in your mouth and then you try and suck in to pull up the balls. So ideally you should be able to pull up all the 3 balls and you keep them there for 5 to 10 seconds. So, it's a result-oriented thing. You're seeing that, yes, how good your lungs are. It gives you an incentive. You do that again. Do this about 10 times and do that about 4 to 5 times a day. So it just opens up your lungs well so that the maximum oxygenation can occur from your lungs.
Everybody may not be able to lay their hands on spirometer, may not be having access to spirometer. But for those people, let me just tell them that an alternative, simple way is to breathe through pursed lips. You can purse your lips and then take deep breaths in and deep exhale out. No?
Out.
So a conscious effort to take deep breath is very, very important. And reclining, slouching actually decreases your lung capacity. It collapses your lungs. So avoid that. When you're sitting, you should be sitting upright with a firm support. When you're sleeping, best to sleep prone. That is to sleep on your belly and not at your back, because there's almost a 3 to 4% of oxygen aspiration, SpO2 difference found in supine and prone position. So sleep prone, that is on your belly. Make a conscious effort to for deep breathing, or you can stand with the support of a table or a chair, keeping your body firm, and then breathe deep. If you get a feeling of coughing, make sure that you put in all your effort to cough out all the sputum that is collected in your lungs. That will actually help improve the oxygenation in the lung. Am I right, Meenakshi?
Yes.
And also the yogic breathing, the breathing that actually tells you to expand your belly really works. Your pranayams, they work to improve your oxygenation, and it's not nimbo jimbo new age bullshit. These are all exercises. These are all
Actually, even that
exercises.
dome Vilom is going to increase it. And I think yoga also helps you with mind relaxation. So it actually works
Yes.
doubly well.
Yeah.
Because
So
it calms you down also, and breathing exercises will always calm you down. And I think, whatever you're doing, if you're doing something towards your health positively, like whether it is the breathing exercises, and not only does it calm you down, it gives a positive feedback that yes, you are trying to do something to help yourself get better. It definitely works.
coming to the fundamental point is that you need to do deep breathing exercises. Whichever form of exercise appeals to your heart, just do that. Whether it is yogi exercise or it is spirometer or anything else, or just simply breathing in and out with pursed lips, do that. And sleeping in prone position is important, because at night time your respiratory drive is low. The breathing effort is really reduced. So it's very, very important that at night you try to sleep on your belly rather than on your back. Uh, Besides the breathing exercise, what are the other things that one can do, to prevent or to deal with the moderate disease? You said
Reach out
steroids
for help
is
and
important and reach out
take
for help,
treatment.
but right now the help, you said hospitalization, the beds are not available. There is a
Uh,
huge crisis of beds now.
I think
So
90% of patients can be managed without going to the hospital. As
right.
Meenakshi said, positive outlook is extremely important. If you believe that you're going to beat it, you will beat it. And it's not a falsely placed belief. 90% of the people are going to beat it. So the red flags, as you said, when they do happen, even if then you start proning, taking care of your health, and doing breathing exercises, you might find in the next 1 or 2 days things become better. And it
Keep
gives you
yourself,
that much, yeah, and it gives you
and
that much extra time to reach for help.
also keep yourself well hydrated. Take good nutrition, take good proteins, because it's going to help you with your illness. Take a lot of fruits. So these water-filled fruits like watermelon, melon, nariyal pani, lassi, chaat. So just keep yourself well hydrated. Also eat well, eat healthy food, and like I said, be positive that it's going to work. But don't become complacent. That is one
Yes.
thing. You must do your exercises. You must keep on checking your oxygen, whichever way, whether it's with the oximeter or, like you said, seeing if you're getting breathless at normal activity or not. But do that. Probably sign up for your tests. Like I know that I have to get them done every third day. I sign up for them earlier only, because if you put an appointment, it has to be done. So,
Yes.
if you plan it out, then there's no panic. Koi lab nahi hai, kuch nahi hai, aisa koi problem hi nahi hai. Because you've already booked it 2 days in advance. When I know that the illness is going to last 10 to 15 days, till 10 days, I'm in complete isolation. I have not sort of, it's my husband's birthday today. I have not hugged him or been close to him at all. I wished him from the other room on the phone. So that's the way it is.
So,
So
we also wish
Meenakshi
him a very happy
is
birthday.
so Atul is not positive.
No, he is negative.
He's negative.
Yes.
So how do you? So this is another question that comes up. Say, supposing two people are positive, one is negative, one is doubtful. Then can the positives mingle?
Yeah, so Nidhi, what's actually happened in our house is probably the most atypical example you can give. Like I said, my mother-in-law is symptomatic, but she's tested negative twice. My daughter's having low-grade fever off and on. She's tested negative twice. My son is completely asymptomatic. Of course, today his D dimers were high, but before that, he's been completely asymptomatic. So he thought the first day that maybe he and his grandmother's sample got switched. So everyone is in different rooms, actually. And my poor husband is just the one who's not symptomatic and not tested positive, and he's taking care of all of us. My son, of course, when the second test came, he kind of accepted that he's positive. So he comes upstairs to sleep with me in my bedroom so that both of us are together. But because my daughter's still tested negative, I wouldn't unnecessarily want her to get any, because she is comfortable with just crocin. Why should I give her the risk of getting the disease? So she's in a different room. Because my mother-in-law is a senior citizen, she's almost 80. I go and give her Claxin as well as steroid shot, because her D dimers and all have also come positive. But the point is, on paper, she's still negative. So I have the space to keep her in her bedroom. Why would I expose her to my viral load? So we are actually, all of us are isolated in different rooms. My husband's taken over my son's room, and he's the one who's taking care of us. We have friends who've been really kind. I've had lunch and dinner dropped to my house every single day of the last 10. So my husband's not had to cook. And that's why I believe that all my friends love him more than they love me, because no one has put him in any trouble, and we've not had to order food even once. So I think that also, that little thing, that there's a patient of mine who messaged me that I got to know that you're unwell. I'm sending fresh vegetables for you. So it was his birthday. His cousin's sister sent a chicken quiche and a banoffee pie over. So someone said something over. So every day there's a little contribution. Hey, I'm sending lunch. Hey, I'm sending dinner. Or I'm sending something for Atul. I'm sending something for the children. It's not about the food or otherwise. But
yeah, it's the thought.
At this point, what I learned, that it feels so good if someone can just drop a message and ask that, is there something I can do? Or just let me know if there's something I can do. There was a patient of mine, her little 2-year-old who I had delivered, just recited a whole sentence that Dr. Meenakshi, get well soon. It was a little video which came in at 11 o'clock last night. Completely heartened me up, that I think it's very important at this time also to show that you care. So whatever little thing you can do, don't send these forwards about ye nahi mil raha, remdesivir nahi mil rahi, or ye nahi mil raha, wo nahi mil raha. But yes, if there's just a message that you can talk to someone, send a joke also, but talk about something other than this and add some light or positivity in someone's life. It's great. There's a relative of ours who was requiring plasma donation. So I just put it on my Insta story and my Facebook story. And by chance, a patient of mine, he responded that my wife is correct, is taking care of the plasma donors. Immediately, I connected both of them. Then there was another friend, her mother required it. So I connected them. And then, they just sent a message that, thank you, you're a lifesaver. So there was nothing much I did. I really didn't do anything. I just put up something that, someone needs it, and just helped with the networking, which even when I'm at home, I can do. But it makes me feel good that, okay, whatever little bit I could do, despite being locked up in a room, I did. And whatever anyone can do for me, they are doing. So I think it's really important that that human side comes out at this time. I know we are all doctors here, but I think I would like to talk about the human side of the whole disease rather than anything else at this time.
There are two questions in the chat coming up. One, of course, is on ivermectin, which we already talked about, Anil. So I think we can just repeat it that, yes, ivermectin dose for the subsequent weeks is what it's asking for. So it's to be taken once in a week for as long as this pandemic lasts.
Or once in 2 weeks, depending on your level of exposure. So I would say that healthcare professionals should take it once a week, but others can take it once in 2 weeks. as Meenakshi said, as I've been saying, as you've been saying, let us not consume scarce resources.
Right.
Let us leave it for people who really need it.
Also, he asked about Fabiflu, the use of Fabiflu, and at what point of time it is required. And as I think we talked earlier in the discussion also, that at the time when the virus is replicating, which happens in the first 2 to 5 days of the disease, that is where these drugs, whether Fabiflu or Remdesivir or Tocilizumab, they work. They have a role to play. After that, their role is very, very doubtful. So it does not really matter much. In the early part of the disease, it is virus which is replicating. Later on, it is the inflammation which is playing havoc. So we have to focus more on inflammation, not on the virus after the 5th day of the disease. We talked about SpO2 and what is the normal range of SpO2? At what point of time should one be alerted, and at what one point of time should one raise alarm and start using supplemental oxygen? Nidhi?
So SpO2 is how much oxygen your blood is carrying for your normal body functions. And normally speaking, for a reasonable fit adult, it will range anything between 96, 98 to even for athletes 100%. But anything less than 94 in a normal healthy adult would alert you to something amiss. Less than 90 is something to be worried about, and the closer you inch towards 80, the more critical it becomes. But to give you all a perspective, by the time we realized that my father was ill, his oxygen saturation was at 81. There was a lot of pressure on us to take him to the hospital and get him admitted, and we consciously decided that we will not go to the hospital. We did not want to take a hospital bed that would be needed for somebody who needed it more, who could be cared for in the hospital and not at home. So the scale of your oxygen would range from 100 to 95, 95 to 90, 90 to 85, and 85 to 80. Less than that is super critical. That means that you need emergency oxygen.
But I would say that anything below 90, oxygen supplementation is required. No?
I would
Yes,
like to make a point here, Sanjay, that like we are all doctors, and you were yourself, like you said, you didn't isolate and you people were taking care of your dad-in-law. But otherwise, you must understand, like, say, I'm a doctor, but the other people who are not doctors, who are doing the pulse oximetry at home, the first thing you need to understand is that if it's coming low, the minute you put it in, don't panic. It's possible that the link, maybe, people just panic in. I've seen it happen with my mother-in-law herself. She panicked and my husband panicked, and I said, just a minute, just put it again and just see, just breathe comfortably, relax, and then just check your pulse oximetry again. Also, just do the 6-minute walk, or otherwise just walk for 2 minutes, inhale deeply, and then check your oxygen. And it usually comes up. Change the finger. It's possible that in one finger you just got it. So don't panic the minute you see that number of 85 or 90. Just
so
relax,
let me add to that. Yeah, this is a right way of checking your pulse oximeter by pulse oximeter. You need to keep it in a finger which is clean. Your hand should be firmly in contact with the finger, and leave the pulse oximeter untouched, unmoved there for 1 minute, and then look at the stable reading. Initial readings may be erroneous, no. So only after 1 minute of putting the pulse oximeter, the reading which comes as a stable reading is the reading that you should go by. If that reading is above 95, nothing to worry about. If it is 95 to 90, be on the guard, be alert. No, if it goes below 90, you need to start supplemental oxygen. If with supplemental oxygen, if the SpO2 is rising above 90, again, you're comfortable. There's no cause of worry, but the treatment should be on. If the oxygen is dipping, that means the inflammation in the lungs has taken a serious level. And you definitely need to address that in a very, very aggressive way, for which Nidhi was talking about the steroids. So Nidhi, can you just elaborate on the treatment at that point of time when the oxygen levels start falling below 90?
So when the oxygen levels start falling below 90, the first thing to do is to get supplemental oxygen. Take a tablet of a steroid. Usually we say that dexamethasone works the best, but any steroid is better than no steroid at this time. the usual dosage of the steroids mostly available are from equal to your body weight, roughly speaking. So, somebody like my father, who is about 90 to 95 kilos, would need about 100 milligram of the steroid. Somebody who is just 50 kilos will need 50 milligrams of the steroid. Also, at this time, you should be taking your ecosprin, your cardiac aspirin, the small one, your other anti-cholesterol and anti-clotting medicines, if they are on. And if they are not, reach out to your doctor so that they can be initiated now. You can ask for them, because these are specialist drugs. They should not be spoken of on a program like this, but you should be informed enough to ask for them if you're not on them. Both anti-cholesterol medicines and anti-clotting medicines have shown extremely steroid sparing effect, inflammation mitigating effect. They hasten recovery and they improve outcomes.
So, for the sake of the audience, let me just rephrase it. That the objective of this program is to make you aware of what are the drugs which work, what are the mechanism of action of those drugs, and we are not really telling you what to take. You still need to consult your physician for the thing, but you should be aware of the thing to know that whether your treatment is on the right track or not. So, oxygen is a very, very important component of treatment in moderate to severe disease. Second is the steroid, and third is the blood thinning agents. Why? Because the oxygen will supply the deficit oxygen in your body. Steroids will take care of the inflammation, which is playing havoc in your lungs, and blood thinning agents to prevent clotting, because clots happening in lungs and various other parts of the body are also adding to the severity of the disease and causing complications, which can ultimately result in fatal outcomes. Yes, Nidhi, go ahead, please.
So the disease follows a trajectory, and that trajectory really decides how to treat it and when to reach out for help, when to be alarmed. The first 5 days, if you are just running a mild cough cold, and the next 5 days you're absolutely asymptomatic, by the 10th day you're free to come out of isolation. So we would say that you should come out of isolation 5 days after your last symptom, or 15 days from your first symptom, whichever is later. That's mild to asymptomatic disease where you needn't be concerned. Now, the 5th day is also the time when the virus stops replicating, when the inflammation starts escalating. If you are going downhill at this time, you are likely to see your fevers rising, your cough increasing, breathing difficulty setting in, you feeling uneasy, you not being able to do your routine tasks like the 1 minute or the 6-minute walk, or becoming breathless while even speaking. This is the time, if you have no help, take a tablet of steroid, ask your friends for a blood thinner and an anti-cholesterol medicine at this time. Try to book an appointment. There are loads of doctors who are doing online consults. They're not even charging. If in the next 3 to 4 days, your blood parameters are coming back to normal, again, don't be alarmed. Carry on with the same treatment. Whoever the doctor that you're following, please have full faith and trust in them. Follow their instructions. Do not say that, okay, I have become well, now I can leave the medicine. Or I have not become well, now I want the remdesivir. This is not the time for remdesivir. This is not the time for plasma. This is not the time for tocilizumab. Because at this time, the virus is already dead. This is the time to rescue the body. And rescuing the body means supporting its basic functions, that of oxygenation, that of mitigating the inflammation. Sometimes we can do it at home. Sometimes we will need expert medical help to do it. Often, again, within the next 3, 4, 5 days, you will know which course you're taking. If it is still going downhill. It is then that you will absolutely need the hospital care. So the time to start asking for a hospital bed or looking for a hospital bed is around day 7, and not on day 10 when you think that, I can't do anything. It's not to occupy that bed. It is just to send out feelers that, look, I may go downhill. If I do, please keep me in mind if a bed falls vacant.
So when the disease is moderate to severe, in the early stages, it can be managed. If it shows signs of improvement, continue at home. But if it shows signs of deterioration, or if it's not being managed on the treatment, then start looking for the beds, and then hospitalization is required. So that is the message, But right now, the situation in Delhi, NCR, and other metros is so bad that there are no hospital beds available. So mentally be prepared to manage things at home itself. You should not give it up. So the objective here to talk about all these things is that you should be mentally prepared that in case we can't get hospital bed, we should be able to manage the patient at home. We should try our best to manage the patient at home.
And I would say that Sanjay, they should reach out. Yeah, I would say that you should reach out to somebody that you trust. There are people who are running online clinics 24/7. Yeah. I am saying this again and again. There are people who are running clinics 24/7. Expert help is available. Reach out. We can all help, and we can give that help even remotely. And outcomes in 90 to 95%, 99% of cases with that help are good. Please reach out.
So consult some physician, consult some doctor who's been treating COVID cases, somebody who can actually handhold you on a day-to-day basis, guide you on an everyday basis that what is to be done, how you're progressing. And that makes a huge difference in the outcomes. What are the other signs which alert us, to the possibility of severe disease that we should actually, raise an alarm and rush to the hospital?
As I said, if the person is confused, that's absolutely like a total red flag. If the person is not able to do their routine tasks with the same mental alertness, let's forget about the physical ability. Physical ability is the first red flag, but if there is mental clouding, if there is confusion, then this is absolutely urgent to reach a hospital.
So possibly signs of, low oxygen.
Hypoxia.
Yes. What you have to look at, oxygenation, whether to the vital organs, be it the brain, be it the heart, and otherwise to the rest of the organs, that extreme fatigue is happening. So basically the kale is all of oxygen.
Yes.
So if the oxygen transmission is not going to the tissues, you will see signs in those tissues.
True.
So if on the other hand, if a person is mentally alert, physically feeling okay enough, that means there's enough oxygen being supplied to various parts of the body, and one should not be really alarmed. But if for a prolonged period oxygen supply has been low, then all the body functions can get adversely affected, which show in sign of as form of, as she said, confusion or a low mental alertness. And
interestingly, the thing that happens when recovery starts, I mean, we have been all talking about all bad things. Let us move to a little positivity. When recovery starts, and I think Meenakshi will tell me also, the first thing that happens is you feel hungry, right? And if somebody tells you that I'm really hungry, be happy. They have made it. Really, I mean, I've seen this with my father. I've seen this with my daughter. And my daughter used to tell me from across the seas. Sania got it in the US. And, when she told me, Mama, today I'm feeling hungry. I said, Sania, you've done it. So, these are the small things to look for, to feel positive about. The body knows and it's telling you. So be mindful of your own body.
Correct. Right. So going beyond this, if a patient does land up in the hospital, then how should the family deal with that situation? And because attendants are not allowed inside the hospital, families are not allowed inside the hospital right now. And what should the family do? So, in other words, what should other people do in the family if somebody is affected with COVID, especially severe disease?
Just support them and trust the doctors. There is nothing else for the family to do. Just trust the doctors to do the best for you. If you have occupied a bed, they will make it work for you. For the others, support the family. Give them food, give them positive feedback, give them love, pray for them, do everything that creates an aura of positivity around the family. But if you have found a bed, trust your doctors.
I mean, actually, coming to the point of vaccination. Uh, so, what would you say about vaccination? And especially, like, now the reports, people after vaccination also are getting COVID. You yourself got COVID. And what are your views on vaccination? Should people get vaccinated or not? And who should get vaccinated? What vaccine to go for?
So, in all honesty, I would say that, a lot of people have been asking me this question, that what was the point of the vaccination if you still got COVID? So, frankly, we all know that this strain is extremely virulent and it's like really spread like wildfire. And definitely that's why a lot of healthcare workers would be affected also. And all of us are also we are, I mean, at the end of the day, we're doctors, but we are human. At the end of the day, we are over 50, 55 with comorbidities and illnesses. It's just because you're a doctor, you're not God. So you are actually high risk population, right? But probably it's the vaccine which has saved us. And actually, if you see, the numbers of problems are much less in the healthcare workers who have been vaccinated by both the doses compared to the general population which has still not got both the doses. So definitely, if anything, this whole episode of getting the illness after the vaccination has only made me believe much more in the vaccine. And I would suggest for everyone, now that the vaccine is open for everyone over 18, that you must register and get your doses as soon as possible. What vaccine to get? I would suggest the one which is more easily available to you and more accessible to you, comfortable to you. Just get it done. We've all got Covishield with. I mean, frankly, I don't think any of the doctors or healthcare workers, when they were getting the vaccine, thought whether they were getting Covishield or Covaxin. They just wanted themselves vaccinated against the illness. And the hype which has come up in this, with every patient asking, I'm getting Covaxin and Covishield, which one should I get and all. I think it's overhyped. You should just get the vaccine which is available to you and get it over with. It's not even worth a discussion. Then, people, as a gynecologist, I have women who are either having hormonal issues or PCOS or fibroids or endometriosis. They may be planning a pregnancy at this point of time. They may be perimenopausal, they may be postmenopausal, during their periods, before their periods, after their periods. Whatever it is, please get the vaccination done. The only people I would advise not to get the vaccination done as of today, this might change next week, because considering the amount of benefit that we are seeing with the vaccine, today at least the ICMR says that in pregnancy you are not supposed to get the vaccine. If you're breastfeeding, you are not supposed to take the vaccine. And I guess if you've just recovered from an episode of COVID because you already have the antibodies, it's a good idea to wait for at least 6 weeks before you get your vaccination. So as long as you follow these criteria, I think the vaccine is meant for everyone.
So I would beg to differ with you, Meenakshi, on a couple of points here. One was, and ICMR does say that pregnancy is a contraindication to vaccination. However, both in the UK and in the US, both in Europe and US,
the vaccines which have been certified for pregnancy are the Pfizer and the Moderna.
Yeah, they're saying
Foxy, but the Covaxin or the Covishield, the AstraZeneca has not been licensed for pregnancy. And since pregnancy is also a hypercoagulable state, and we have seen some clotting with the Covishield, it is yet not licensed. It is possible. See, as an association, as Foxy, we have put in this request that maybe if it is more life-saving, it be given to women. But since studies are not yet available, today Foxy's position paper was, because of this pandemic which is there and the situation getting worse day by day, that, maybe that option can be offered to your patients. But honestly, till the time we don't get guidelines, you have to work on some guidelines. I can't work on a gut
Yeah.
feeling when I'm
No,
working
no,
in
no, 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 no. That's what
So
I
the
was telling you.
guideline is very clear currently. The Indian vaccines, I just want the message to be completely clear. Today, the vaccine is not licensed for women the Indian vaccines are not licensed for women in pregnancy or lactation. If you've already breastfed for 6 months, maybe not a bad idea to now stop breastfeeding and get the vaccine, because definitely you benefit more from it than otherwise. But while
Yeah.
you're breastfeeding and you're pregnant, you are not going to take the vaccine today. This might change next week.
Maybe
Yeah.
your views on vaccine?
So that was one point, that everywhere else it has come to light that vaccination confers passive immunity even to the fetus. So as she said, that the vaccines which are available in India currently have not proven safety for pregnancy because it is a hypercoagulable state. And that caveat holds. However, vaccination per se is not contraindicated in pregnancy. So that's one thing that I wanted to clarify. The other is that uh, the two vaccines are very different platforms. Covishield is a live attenuated virus, a chimpanzee virus, which is carrying a part of the genetic material which codes for a part of the virus. The Covaxin is a dead virus vaccine. And dead virus vaccines, though, are not very immunogenic. That means that they would probably not have a spiking response to create immunity. They are very safe. And you may have to repeat those doses, maybe more than once, to get the same response. So, logically, scientifically, between the two vaccines, probably Covaxin is safer in a lot many more people than Covishield. However, the choice is not which vaccine. The choice is vaccine or COVID. And the choice there is very clear. It is the vaccine. So whichever vaccine you're getting, be mindful that vaccine protects you and saves you from COVID. I'm a strong advocate of vaccination. At this time, however, with the current pandemic surge, I would say either be very, very certain that you're not bringing back COVID at the time of vaccination, or wait for a couple of weeks, let this die out, go in a more safer environment, take precautions, and then get vaccinated. So vaccination, absolutely. Which one doesn't matter. At this time, stay back, hold back, let this surge die out. I think the surge is also driven by a population that became complacent. We can't blame the government for everything. When the government put a lockdown, we were blaming the government for the lockdown. When the government has not put the lockdown, we are blaming the government for not putting the lockdown. As a population, we have to begin to act intelligently. In a time of war or a war-like situation, you don't say that you're not letting me go to buy food. You make the food with what you have at home. In a time where this is war-like situation, you don't complain that I'm not bringing back money. You make do with the money you have. So stop complaining, create an atmosphere of positivity, do your bit. Don't go out.
Correct. So to put the vaccination in a different perspective, that vaccination is like, you secure your house by putting locks there. You put security cameras, you put security guard. Yes, it provides security most of the time. But yes, there's still a remote possibility of robbery happening in your house now. So don't think that a robbery cannot happen with all the security. But if you were to leave your house unsecured and open, you are more prone to the robbery and theft. Similarly, is the vaccine. That having vaccination gives you a certain amount of immunity and protection against the disease. It is not 100%, but it is far better than not having any protection at all. So go for the vaccination, whichever is available to you. Do your research, whatever the knowledge is changing from day to day. And the recent studies by ICMR have shown that Covaxin has got some advantage over Covishield. Some research, I think even in the US also, there's some report which says that Covaxin has got better protection against the newer strains of the virus than the Covishield. But whichever vaccination you're able to lay your hands on, you should go for that. And as has been pointed out, that it is the human behavior which is more important in preventing the spread of the disease. Now, let me put it another way. Doctors can treat you when you get the disease. Doctors can help you when you get the complications. Doctors can help you with the medicine, treatment, and support. But doctors can do nothing about preventing the spread of the disease. The prevention of the spread of the disease or this pandemic has to be done by us people on the ground, everybody. We have to take steps. We have to protect ourselves. We have to prevent the spread of the thing. Somewhere down the line, in the past few months, we became a little too lax. We became restless. We jumped out of houses. We threw away our masks. We wanted to go back to the same old life before COVID. And the result is that COVID is back in a bigger way. So let's take this as a lesson, a very expensive lesson, so to say. But going forward, we should all be very, very careful. There are a few, I think, comments and questions which are there on the chat. Now, Anil Goyal said that I'm non-diabetic and taking Medrol 16 mg for 5 days and intermission order. I was told that my sugar levels may increase because of this steroid. Please advise. Do not worry. Once you stop the steroids, sugar levels will come back to the normal. You're not a diabetic person. If you're diabetic and if you're on any diabetes medicine, you may have to increase the medicine for some time. But again, once the steroids stop, it comes back to the normal. The effects or the side effects of steroids are easy to manage than the complications of COVID. So one should not hesitate in taking steroids, especially under supervision. So if your doctor is prescribing you steroids, whatever dose they're prescribing, go for it. And mind you, it should be a full dose based on your body weight, not an empirical single figure for everyone. There's another comment. Somebody said that they checked their SpO2 level, and when they took the mask off, it improved. Yes, it does make a difference. If you take deep breath, if you breathe properly, if you remove a mask, it does improve. So maybe when the patient is alone in the room, isolated, need not have the mask on. But when somebody is coming into the room to take care of the patient, to tend to the patient, then both the attendant, or the person who's caring for and the person who's cared for should have the mask on. Breathing exercises of any form do help. And so there's a question by Anil Goyal again, that after COVID, when should one take vaccine? I think once you get COVID and you're fully recovered, you should wait for about 3 to 6 weeks before you go for the vaccination.
I would like to say something here.
It also help to get the antibody tests done, to see the level of your antibodies. If they are low, then it's as good as not having been infected. You can go for vaccination immediately. If they're high enough, then you may wait for about 3 to 6 weeks. Yes, Nidhi, please add.
So I would like to say here that any illness, so this vaccine is a viral vaccine, and any viral illness will have kicked off an immune response, which is what we want from this vaccine also. And when you have had any illness, even a mild cough and cold, if you've had it in the 3 weeks preceding your vaccination date, delay your vaccination. The immunogenicity of especially the Covishield will make the vaccine a little more troublesome for you. Also, with the breakthrough COVID and post-vaccine COVID becoming so common, when you do get vaccinated, do not ignore your symptoms as simple post-COVID, post-vaccine illness. Be alert to them being something different if they're not becoming okay in 3 to 5 days.
So here, basically a word of caution is that right now, due to the surge of cases, it's not a good time to go out anywhere, not even for vaccination. We should wait for some time that the cases settle down, that this wave settle down, and then go for vaccination. People often ask if they have severe allergies, what to do. People who have mild allergies can take their anti-allergic medicine before going for vaccination. But if somebody's got a moderate or severe allergic response to anything, then go for vaccination in a hospital setup or in a center which is equipped to deal with any emergency, and alert to the attending doctor over there that you have a particular allergic reaction. A lot of vaccination camps are being organized in the communities, in offices. People who have got allergy or have any significant illness and all should probably avoid getting vaccinated at these places. They should go to a hospital set up for vaccination. Any other question, any other comments anybody has? I'm glad to see Ankit having joined despite being ill himself. Ankit, all the best to you. May you get well soon, and prayers and condolences for your loss. So I think we've taken care of all the questions in the chat. Right. So what are the final take-home messages for the audience, Meenakshi?
I think prevention is the most important thing. To continue double masking, wear mask at home, because what we've realized in this wave is that one person in the family is the one who is giving it to others, rather than people getting it from outside. One person will get it but pass on to others. So eat your meals separately. Probably at this point of time, be very, very careful. And prevention is most important. And if you do get COVID positive, keep a positive attitude. You will probably be in the 90% where there's going to be no major problem. And take care of your disease. Don't be complacent, but eat well, be healthy, be positive, and just do your follow-up properly. And I think you should be able to sail through it comfortably.
Great. Nidhi, what's your message for the audience? The final take-home message.
So I'm very emotional about this thing, and I feel like often we get lost in negativity. And as Meenakshi said, be positive, keep a positive outlook, help out people who need help. For yourself, you should be the full stop. You should be the person who controls that COVID will not go forth from me, even if it catches me. And the way to do that is to fortify your own defenses, to be mindful of your own behaviors. You should eat good food, exercise a little, do deep breathing, take vitamins, do all the things that we were taught as nursery kids. Wash your hands, leave your chappal outside, do all those things. But wear your mask. Do not go to crowded places. Do not go, full stop. If you don't have to go out, stay at home. Do not let this panic overtake you that you're spraying grocery and vegetables with sanitizer sprays. Mild detergent will kill COVID even if it came in on groceries, and it does not usually come in on groceries. So wash your produce before you eat it. Eat good, local, freshly prepared food.
So there was a mention about exercise, that continue with the exercise. So I'll put in a word of caution over here. At this point of time, avoid very strenuous exercises. Avoid your long runs and very strenuous workout. Just maintain your fitness level. And you should not be, it should not be that you're, degrading your muscles or breaking down your muscles. It's not the time for that. I've had friends who, after their long run, developed COVID. And because after a very long run, when the body goes into a destruction phase, and a recovery phase, the immunity may be a little low, and the body is more predisposed to getting the disease. So avoid the long runs, avoid those severe, heavy workouts. Keep it mild to moderate. Just maintain your fitness level for all those fitness enthusiasts.
So I would say exercise a little. As I said, exercise a little. Yes. And it does two things. A little exercise does two things or three things. A little exercise gives you some positive endorphins and a sense of achievement, which is very needed at this time. Whether it is yoga that works for you, a walk that works for you, whatever works for you, but continue to do that. The second important thing it does is that it keeps your circulation and lung health healthy. So you have a parameter to judge early falls from your usual normal. And that's the third thing. That you will pick up early signs by being mindful to what you are not able to do now that you were able to do earlier. So I'm not saying that you should go all out and do 120 kg deadlifts. No, a little bit every day that tells you that you have done it and that you have been doing it and it still works. And now, if it doesn't, is there something for me to start now? I should reach out to somebody who can help me.
So, in other words, one should scale down at this point of time and just have a maintenance regime in your fitness, not an escalating regime, not a build-up regime, just a maintenance, a low-grade regime. To sum it up all, as the final word, I would say that in terms of prevention, the time has come to double mask yourself. That when you go out, you should always have double mask on. And what I say, tell everyone, all my friends, all my patients, everybody, that right now, do not go out. Don't let anybody come in. That is the only way to prevent yourself. That's the only way to prevent the disease. That's the only way to save yourself. Don't go out. Don't let anybody come in. But if your work, your life demands that you must go out, have double masks. Use social distancing. Sanitize your hand. Take all the precautions that you take. And for people who go to hospitals and medical care facilities or to any crowded places, they should ideally go with N95 mask, maybe another mask on top of that. So it's time to switch to N95 mask for even general public. Then, if, God forbid, you get the disease, then early treatment started at home is very, very important in preventing severe form of the disease. So early home treatment is the key. If it goes to a stage beyond that, then know that the virus is replicating only in the early part of the disease. In the later part of the disease, it is the inflammatory response to that which is playing the havoc, which is causing all the complications. And most fatalities are happening because of those complications, not by the virus. So the antiviral drugs work early, they do not work later. Later in the course of the disease, oxygen, steroids, blood thinning agents are the key pillars of treatment in moderate disease. If it goes to severe form, where you land up in the hospital in ICU, then your intensivist would know what is to be done. But maintain a positive outlook, maintain a positive attitude, and take all precautions. Now, it's easier to bear the discomfort of not going out of the house. It's easier to bear the discomfort of lockdown. The loss you incur by not working for a few days is lesser than the financial loss that you can potentially incur if your family were to get a severe disease. It's very expensive. The treatment is expensive. Everything is being sold in the black market. Drugs are expensive. Everything is very, very expensive. The treatment itself is very, very expensive. And of course, afterwards, you may not be as productive for some time to come. So prevention is the best policy in this disease especially. With that, I conclude today's session. I'd like to thank Dr. Meenakshi Ahuja for coming onto the show despite being herself not well, having suffering COVID herself and her family being involved. But that's very strong and bold of you to come on. Thank you very much. I thank Nidhi very much for coming on the show and enlightening all of us with your abundance of knowledge. And to all of you, thank you very much. Best wishes for a very healthy and happy future. Take care, be safe, protect yourself, protect your family, protect your friends. Bye-bye. Good night. See you again next week. I welcome all of you to IBM TV and to this show, which is Dr. Dhawan's live chat, and I'm your host, Dr. Sanjay Dhawan. I'm an eye surgeon practicing in New Delhi. The live chat is a show which talks about any and all aspects of life, any subject, anything that concerns the life or it improves its quality is what we will be talking about. How to plan for it, how to prepare for it. So we'll be talking about all of this. Looking forward to seeing all of you every Friday night, 9:30 p.m. to 10:30 p.m. Indian time. Thank you. Bye-bye. Namaste.